Hello everyone. I am Sanjana, Onco nutritionist from ZenOnco.io. Today we shall be discussing on an important topic which is nerve injury or nerve numbness and the nutritional management. Now most of the cancer patients come to us and they tell us that ma'am, I'm experiencing numbness in my hand near the IV site, or I'm also experiencing tingling sensation near the IV site. There are two reasons why this could happen. One is an underlying nutritional deficiency of vitamin B12. Vitamin B12 has been also implicated in causing peripheral neuropathy as well. And the next, it could be because of the chemotherapeutic treatment which the patient is undergoing. Now, when peripheral neuropathy occurs in the cancer patients who are undergoing a chemotherapy, it is known as chemotherapy induced peripheral neuropathy. If a doctor is going to suspect an underlying nutritional deficiency due to which a tingling sensation or numbness is occurring, then surely they will be advising you for a blood test to rule out any other condition. It is very important to understand the symptoms of this and get timely intervention or evaluation from the doctor. Especially when you're undergoing a chemotherapeutic treatment, the numbness or the tingling sensation can occur at the axis site of where the IV has been inserted. So it is very important to understand the symptoms and get an early intervention done. So now what happens is that chemotherapy induced peripheral neuropathy will occur at the onset, or it can continue even after the chemotherapy has been done. There have been a lot of research studies which are being done to understand the role of various nutrients which can play a role in reducing the peripheral neuropathy and also by reducing the inflammation in the body as well. Now, when we say there is a nerve injury, there is also some amount of inflammation which is going to occur. Now, there are certain foods which, when we eat, contain the pro inflammatory nutrients. Now, regarding this, I have already spoken in one of my earlier videos. Okay, so when we are going to eat foods which are having the pro-inflammatory nutrients, again it is going to cause inflammation in our body. However, we want to reduce that overall inflammation in the body. Okay, so now there was a research study which was done to see the association of dietary magnesium and the calcium intake in colorectal cancer patients who were undergoing an adjuvant chemotherapy. So these patients were given magnesium and calcium through dietary intake, and the study showed that dietary intake of magnesium and calcium did help in reducing the risk of colorectal cancer and the severity of the chemotherapy induced peripheral neuropathy in these patients who were undergoing a chemotherapy as well. So yes, nutrients do play an important role in reducing this. Now we will go to see the important nutrients and the rich sources which you can surely incorporate in your diet as well. Okay, so the first one is calcium. So what are the rich sources of calcium which you can incorporate in your daily diet? So one is broccoli, spinach, A2 milk and milk products like curd, buttermilk or paneer. You have your chickpeas, tofu, ragi, sesame seeds, drumstick and even almonds as well. Next is magnesium. Now, magnesium is found in pulses and legumes like black beans and lentils. It is also found in nuts and seeds as well. All right, and you can also finding them in the vegetables also. So these are some of the important nutrients, and what are their rich sources which you can incorporate. Next is vitamin E. Now, there are also a lot of studies being done to understand that what is the role of vitamin E and how could it be beneficial in reducing peripheral neuropathy in cancer treatment as well. Now, if you go to see, vitamin E is a very powerful antioxidant which is also going to help in reducing or destroying the free radicals in our body as well. Okay, so what are some of the sources of vitamin E which you can incorporate in your diet? These are your nuts and seeds like almonds and sunflower seeds, spinach, broccoli, and even vegetable oil as well. Zinc is also an important nutrient which has been shown to play an important role in reducing peripheral neuropathy in cancer patients. Now, zinc is commonly present in the seeds such as the pumpkin seeds, and it is also present in whole grains like millets, brown rice, or quinoa as well. So, to conclude, yes, it is very important in understanding and also to figuring out these symptoms and getting timely evaluation from your doctor. You can surely incorporate the foods which are rich in iron, which are rich in calcium, magnesium, vitamin E, and zinc in your diet as well, which also play an important role as anti-inflammatory or antioxidants also, which are going to be beneficial in reducing the peripheral neuropathy related symptoms, if any. Thank you so much for watching my video. We at ZenOnco.io are here by your side during your cancer care journey. In case of assistance, you can surely reach out to our cancer coaches in the below mentioned contact number. Thank you.